Hello, I'm your host, Brett Barrow, founder and CEO of HerFeed. As a reminder, the information provided during this event is for informational purposes only. This event does not create a doctor-patient relationship, and any questions or medical advice discussed is not considered guidance on what you should do. For medical questions, please reach out to your primary care or healthcare professional. Joining me today is nurse practitioner Jamie Hilbert, an ExpressCare virtual provider here at Providence. Hi, Jamie, and welcome.
Hello, thank you so much for having me.
Of course. Before we really delve into what we're going to talk about today, can you tell us what your role is here at Providence?
Definitely. My role within Providence is to see patients on a same day, really is what our focus is, virtual platform. So we use Providence Health Connect, and that's how patients can actually schedule, get put in a virtual waiting room and see a provider that is a nurse practitioner or PA, get their issues addressed. If it's something that we can't take care of on virtual, which does happen from time to time, we can actually get that patient connected to an urgent care in their location.
And my sound sounds a little off. What are some of the patient issues that can be addressed by utilizing virtual ExpressCare?
So I would say the majority are like your urgent care type visits, right? So I woke up this morning, my eye is bothering me, it's red, I have a runny nose, my ear hurts, maybe I have a urinary tract infection, I may be having a stomach ache. I'm not sure if it's something I need to go into the ER for. We very commonly answer that question for patients of, do I need to be seen in the ER? And the great thing that the virtual platform does for us that we can't really do on like a nurse advice line is we can actually see the patient. So we can actually see what's going on with them. We can see that red eye, right? We can prescribe medications if necessary. But if it's something that you're like, I'm sorry, as a provider, I think this needs to be seen in person, we can actually take care of that, get you connected up with a person in your location that can actually look at that eye in person and make sure that everything's okay if we need to.
Oh, that's incredible. So how does somebody actually access this type of service? How do they access virtual ExpressCare?
So the easiest way is to go to virtual.providence.org, and from there it'll actually walk you through the setup process. So you'll click on a big green start the visit now, and it will ask you basic information that you'd probably give at any doctor's office, right? So your name, date of birth, maybe an address, and you do not have to have insurance. We do have a great self-pay rate of $49 for the visit. And so if you don't have insurance, that's not a problem. We do have you go in and turn that information. If you do have insurance, you will provide that information to our virtual registration person, and then they'll get you connected. Wait times do vary a little bit, but I would say very commonly it's like 20 minutes at most. To get connected. If it is longer, it does tell you what the wait time is, so you can always come back another time if it's more convenient for you. That's the great thing about it being virtual, right? Is that patients can sign on and they can kind of go about their daily lives. I've definitely connected with patients in the middle of doing laundry and getting their daily chores done, doing dishes. And they just stop and they have a really nice, relaxed visit with me and tell me what's going on. And then they can get back to their lives.
That's amazing. And I feel like especially right now where some people really don't feel comfortable still leaving their homes, understandably so, or, if you're a stay-at-home mom, for instance, and you can't get care, it has to be so nice and reassuring to have that type of convenience literally at your fingertips. How would you recommend that someone prepares for this type of virtual visit?
I would say the most important thing is if you've collected any vital signs. Some patients have taken like a temperature before they've come online. Some patients have like a pulse oximeter or a smartwatch. If you can have that data available to us. I've even had some patients connect and they've already taken pictures of their rash or their bump that they want me to look at. That's great. If we can get a picture of that, we can actually do a screenshot of it during your virtual visit and add it to your chart. We do use Epic. We use MyChart. So you can get access to us with that after the visit, but we add it to your chart and then that can be communicated to your primary care as well.
So can you tell us about how, because you've kind of mentioned a few things now, how ExpressCare is, or what, how about this? Why would a person come into something like ExpressCare? Why would they use something like ExpressCare versus doing like a virtual ExpressCare? What would be the difference there?
So I think with ExpressCare, if you're looking at something that you really need to see in person for, right? So something like the ear, we can't really do an ear exam very easily on the virtual platform. So that's something very commonly that we will have somebody go into an ExpressCare clinic for.
Oh, that makes sense.
Sometimes we aren't able to just because of connection issues or the patient's ability to get onto a camera that is going to allow us a good visualization. We may ask that patient to go in to a freestanding site and see somebody in person at one of our ExpressCare clinics. But I would say the vast majority of issues we can't actually see on ExpressCare virtual. And I would say the one area where I would really encourage patients to come onto virtual is if they think they have COVID. We really want those patients to come onto the virtual platform. We can take care of everything, and then we can actually send them to an in-person site to get tested.
Oh, wow. So if a person is thinking that they have the COVID symptoms, you're saying to use this virtual type. That's incredible. That, I mean, being able to get some direction and not feel like you are stuck, having to go into a clinic or something like that, or just basically, sitting there and Googling symptoms. Like it must, it's nice to have that sort of reassurance. So is COVID testing available through ExpressCare?
So depending on the service location,
Okay.
we are determined by how many tests that we receive from our manufacturer. So that does tend to fluctuate at times, but we do have relationships with other groups. So if necessary, we can always recommend to a nearby lab or other facility for testing. Our providers stay pretty up to date on what's available in the area, so that if you may not meet our criteria, we do test patients who are symptomatic. If maybe you aren't really symptomatic, you've just been exposed, but you really want to be tested, we can have a conversation as a provider and help point you in that direction.
Oh, wow. That's really good to know, actually. So kind of going backwards a little bit, just about ExpressCare in general, it seems like there's a lot of innovations and a lot of advancements going on. Can you tell us about some of these in terms of the healthcare industry?
Wow, we have so many. I think what was really impressive was what Providence did with the onset of COVID and really doing a lot of home monitoring. So our patients that were going into the hospital and they were being treated for COVID, and then when they were discharged home, we were setting them up with care packages to test their oxygen saturation, their temperature. We were giving them those devices. And then we had nurse practitioners and physician's assistants that were actually contacting those patients and monitoring those values with them. I think that was probably one of the most innovative things we started doing with the COVID presentation. But I'm really impressed with how much that we're doing to promote safety in our in-person clinics. So when we do have patients come in, we're limiting it to being that one patient being seen at that time. We're not having our waiting rooms full of people. We have one person in the waiting room and we're taking care of one patient at a time. We're disinfecting between every patient. And we're making sure that we're checking patients and screening them and taking temperatures when they come in. If you don't have a mask, we're giving you a mask, and we're using masks in all of our clinics. All the in-person clinics, patients are wearing masks, staff are wearing masks, and we're really trying to make sure that we're creating a safe environment for people, both the patients and the staff, that they can get the care that they need and they don't need to be fearful.
Wow, that's amazing. What are, speaking of kind of technology, and why are electronic medical records better than paper ones, in your opinion? Because obviously a lot of what we're talking about right now is doing virtual appointments and things like that. And I think one concern that a lot of people have is how safe are these records, and, who has access to these records. But on the flip side, it makes things so much easier, especially for a big, hospital system and network like Providence, I would imagine.
So I will say it's not really easy to access your records. We do have to have a reason, right? We're not accessing records of patients just whenever. When you do sign up with us, we can do a scan when you tell us what pharmacy you use. So if you say, I'm using Walgreens pharmacy, I can actually connect with that Walgreens pharmacy and hopefully get some medication information back for you about what medications you're on. You can allow the MyChart or Epic to share within different organizations. I'm in Los Angeles, so you can share your record between Cedars-Sinai or UCLA. I've gone to a UCLA doctor. I'm also a Providence patient. I've shared that record with my UCLA, so I can share those lab results, but it's not like any doctor can get them. I have to make that choice to share that information. So this information is secure. The best thing about it is that it allows you to have a private conversation with your provider. So when you have that after visit question and you're like, I don't remember what they said, that so often happens to patients. They get done with the visit. What was it all about?
Yeah, okay.
We actually send you information through MyChart, our Epic MyChart. That's the patient side of things. And you can go back and review the information that your provider shared with you, and you can send a message and ask us questions back. So it's a great way to get two-way communications. Patients can send us pictures and show us that rash is getting worse, that rash is getting better. Oh, my pink eye is getting better. Look and see. And it's such a great thing as a provider to have that type of communication and be able to see those pictures and see things getting better.
It's funny because I had gone to a doctor's appointment not that long ago, and it was so nice to not have to fill out the paperwork. I went to a new doctor, not have to fill out that paperwork and just spend that 10 minutes trying to, pull out my license, just whatever it was, just spend that extra 10 minutes. I could have it done ahead of time. They had the information, but the best part about it was that afterwards, the prescription that I needed, I didn't have to do anything. I didn't even have to tell them, what the pharmacy was. It was called in before I even left the office, which to me, so that little bit of convenience and that little bit of time saving was so beneficial. What kind of caregivers, I feel like this is a important question to address. What kind of caregivers work at ExpressCare locations? And what are the types of services that people can provide? You've kind of gone over that before, but what can people expect in terms of who will be there at these ExpressCare clinics?
Right. So all of our providers are board certified, nurse practitioners or physician's assistants. And we do have communication with physicians that we can contact at any time. They're always on shift that we can communicate with and ask questions if necessary. But all of them have predominantly a family practice background. So all of us have either board certification in family practice or have done extensive work in family practice. We all see pediatrics, we all see adults, we all see geriatrics, and we all have pretty diverse knowledge. I will say there's some of us that have had maybe some in-depth experience in ear, nose, and throat, or in gastroenterology or cardiology, but we all have a good foundational knowledge in just your basic type of ailments.
What's the difference then actually between ExpressCare and urgent care?
Right. So urgent cares do vary from site to site, and we are included right in the Providence system as kind of an urgent care type service. But urgent cares can sometimes offer things like IV services, X-ray on site. Our freestanding locations do offer laboratory services, so we can draw blood for our patients that we're seeing, and we can obtain specimens and send those to the lab as well. So we very commonly on virtual may need to do a urine test or something like that, and we can order that test to be completed at the freestanding ExpressCare sites. We definitely do full exams. So everything, we have chaperone abilities. We do provide chaperones for any intimate type exams that need to be completed. Patients can always ask for a chaperone. We usually have them there automatically if it is a type of an intimate exam, but they can always ask for them. And that's just because we have additional staffing available to us in those freestanding sites. We don't typically deal with any sort of intimate exams just because of the video component of things on the virtual visits. We would probably recommend that you go to a freestanding site if it was a rash that you wanted checked out in someplace more sensitive.
That makes a lot of sense. What about, speaking of, I guess, ailments right now and everything, and something that we're hearing a lot about right now is the flu. So what about flu shots? Can you get them at ExpressCare clinics, or is...
Most certainly. All of our ExpressCare clinics do offer flu vaccines, and we can offer those even for our youngest patients. So I would say yes, definitely. You can schedule on the portal, which is through providence.org. You can go and make an appointment actually at a standing location, and get a flu shot. But I will also add, on the other side of things, we do actually use a pretty high level detecting flu test. And so we're able to say with 99% certainty if you have the flu.
Oh, wow. I had no idea. It's incredible.
It's actually awesome. Most standard flu tests are only about like 70 to 80% accurate at best. And the one that we use is actually a rapid like NAAT test, and it actually replicates the virus. It heats it up and actually detects the molecular structure of influenza A and B. And so with 99% certainty, we can actually say, yes, you have the flu, or no, you don't.
So there's been a lot of talk about COVID testing, and I personally, I maybe should be embarrassed to say this, but I don't know how a flu test, just for anybody who might be curious, including me, how is a flu test done versus like a COVID test?
Unfortunately, the COVID test is actually pretty painless. Our COVID test is just a NAIRS-based test, so it's only going up about this high. Our influenza test is based on a posterior, so back of the nose specimen. So it's a little bit more invasive actually than our COVID test. But I recently actually tested a patient and kind of guided him through testing for that. And he was like, that wasn't nearly as bad as I thought. It was really not that bad. And I would say the most horrible complication most people have after testing is they sneeze.
Oh, I feel like I'm sneezing all the time lately. So I feel like that's not that bad at all.
It tickles the nose for sure.
Oh, that's interesting, because I feel like we've heard a lot about the COVID test, but we haven't really heard about the flu test. So that's good information for everyone to know. And should you be sick, or should you get sick, is there a pharmacy at these ExpressCare locations?
So we may be hopefully opening some of those back up. Originally, ExpressCare was inside of Walgreens clinics, and we are hoping in the near future to open some of those clinics back up. However, some of them did close just because we wanted to make sure that we were maintaining safety for everybody. We haven't had those open, but we are hoping to open those back up soon. A lot of them are on the calendar to be open in the next couple months.
Oh, wow. And you said this before actually, but one of the questions that we had was, does ExpressCare take insurance? So can you kind of walk us through that again? You said...
Yes. So we take a lot of the major insurances. Many times we can bill insurance directly and get that all taken care of. We actually do communicate through our virtual registration staff about coverage and if we are on plan or not. Always you want to check with your individual insurance and make sure that we are a covered benefit for you to be seen with ExpressCare and with Providence. There are some very closed insurance companies systems where they say, no, you have to go to their options. But we've definitely seen patients from Kaiser, from Aetna, from Blue Cross, Regents, many different plans. So definitely, communicate with whoever is managing your insurance, whether it's your employer-based HR or your actual direct insurance plan, and find out if they are on plan. And in most cases, we can definitely see you.
And in terms of where these locations are, the ExpressCare clinics, like where they are located, I know you're based out of Los Angeles. Can you give us a little bit of an idea of where else people can find these?
Definitely. So we actually are all over the West Coast. And the great thing about virtual is even if we're not like in a freestanding location in your area, if you reside anywhere in California, anywhere in Oregon, anywhere in Washington, anywhere in Montana, anywhere in Alaska. We're going to be able to take care of you virtually. So if you, like I said, if it becomes a situation that we can't finish the visit, or we really feel like you need to have an in-person visit, we can communicate with your local area urgent cares, ERs, and get you that next level of care. So it shouldn't be an issue if you live in those states. We have providers that can see you.
That's amazing. That, I mean, there's, we yeah, no, that's amazing. I feel like there's, especially right now and with flu season and, so much going on, the fact that there is this option from the comfort of your home is absolutely incredible. We've pretty much covered everything, but is there anything that you want to add before we get going?
So I would actually just really like to encourage patients to try virtual. I think it's really interesting. I've done in-person visits for a large portion of my life, and I was definitely a provider long ago with paper charts, and I did all that. And I did the in-person visits. And I think some patients are very worried that you aren't going to be able to get that same level of relationship and relational interaction from a virtual visit. And I really want to encourage people that you can. I think if you'd asked me a few years ago, like, are you even feeling like you're connecting with your patients doing virtual visits? I probably wouldn't have said yes, but my exposure was so limited and what I understood it to be was so limited. And now coming forward to where I'm at now, and I've done so many virtual visits with patients, and it's so awesome to come into somebody's house and, I'll see little 3-year-olds and they're bouncing all over their mom on the couch while they're doing the visit, and there's no fear. Right? Those little kids that have a fear about going to the doctor's office, it's gone. And I can just have a conversation with mom and say, hey, what's happening and what brought you on today and what's your concerns? And they can just have a relaxed conversation in their own home about what's happening with their child. And the kids like running and getting, their butterfly wings from their room or whatever it is to show me. And it's actually very relational, and people feel very connected actually on virtual. And patients really feel like they are being heard. It's not like, we're sitting in some very distracted location. It's actually a very intimate encounter. And patients really feel like they are getting their issues addressed. And very rarely are we having to send patients off somewhere else. It's not something that we're doing very commonly. And sometimes it's something very simple. And it's just, hey, I need a refill of this medication and I can't get in to see my primary care, but I don't want to stop taking my blood pressure medication because of it. And we can just send them in some medication to get them through until they can get into see their PCP. And that's really helpful for people. Our most important goal at Providence is to aid people's way. That's part of our mission. And we want to be that connection for people. We know that patients are fearful. We know that they're worried about the flu. They're worried about COVID. Mm-hmm. They're worried about, oh my gosh, I woke up this morning, my nose is running. What does this mean for me? And you can actually have that conversation with patients and say, we understand where you're at and we're here to help you, whatever that looks like. We can provide you a doctor's note. We can get you tested. We can, get you the care that you need. We can prescribe you medications. We can actually meet those needs, and you don't even have to leave your house. You don't have to worry about whether or not, you're exposing anyone else. You can ask your questions no matter how stupid you feel they are. And there's no judgment. I mean, the patients really feel like they can be heard and connected with. And so I would really encourage patients, if you haven't done a virtual visit yet with Providence, really consider it, because I think you're going to be surprised. Our scores for patient satisfaction are through the roof. I mean, we have so much praise that are coming off of our virtual providers, and they really try hard to go the extra mile for their patients and make them feel like they're really cared about, and that make it easy for them to get the medication and care that they need. So I really don't want that to be a hindrance to anybody that they're coming on to virtual.
Yeah, no, I'm completely sold personally, but I also think having that peace of mind and, it's a service that allows us to feel like we're sort of in control when a lot of things in the world seem a little bit maybe out of our control. And I think it's a really good way for people to not put off little things that could get worse. You know, that ear infection, maybe not ear infection, but the pink eye, you don't want to let that go. But, you know, being able to get like a quick answer and get your, you know, problem solved is going to be much better for your health overall. So I really appreciate you taking the time and talking today, Jamie. This has been so educational and so informative. And to everyone for listening and watching, thank you. To learn more about our initiatives, programs, and services and ways to give, or if you're looking for medical care, please visit providence.org and make sure to follow us on social media at Providence Health System for LinkedIn, Facebook, and Instagram, and under Providence on Twitter. Thank you so much for watching, and thank you so much again, Jamie, and we will see you soon. Bye.
Thank you